Last week, the teams of McMaster University undergraduate students, graduate students, and alumni presented their problem pitches to the key stakeholders for St. Joseph's Health System's Integrated Comprehensive Care Program. This week, students presented their impactful pitches in front of a panel of judges as solutions to the problem they discovered over the past 2 weeks. What innovative ideas did the students come up with?
Brief overview of our solution to addressing this gap in knowledge between the primary care solutions and the integrated comprehensive care model would be to educate them by incentivizing them with continuing medical education units.
So our group solution was to implement MyCharts, which is a current program being used in several places around the United States, as well as in a lot of hospitals over in Ontario, so Sunnybrook, Ottawa, and the solution was to take that platform and kind of mold it into something that's a little bit more appropriate for St. Joe's and to incorporate that here in order to bridge that gap between what the patient sees in terms of their health information and what the physicians can input into that software.
We identified several problems and we identified 9. Our solution actually tailored to 4 of those, and that includes follow-up, home care monitoring, home care assessment, as well as predictive analytics. Our solution was to use Amazon Echo and its software Alexa to provide a more comprehensive care to patients, especially in-home care, and to actually predict their COPD exacerbation probability using analytics.
The solution that we presented was related to providing patients with better access to their prescription medication and then unifying doctors and other care providers like the nurse with that information.
So we kind of wanted to reorganize a little bit and augment the program with currently existing care programs and with other caregivers within the community to kind of integrate the community within the model so that they become comfortable with other options and their post-ICC options. And then once they've been discharged, hopefully that will inspire confidence in them and it'll reduce any kind of fear or anxiety that they have once they've been discharged from the program.
You know, I think we were really very impressed with all the different aspects of the program that were brought forward and all the team's presentations, a huge variety and frankly things that we hadn't even been as focused on in the ICC program. So it was really enlightening for us as a process.
I think I was really struck by how diverse the solutions were and how the different groups took the different elements of ICC and what we're trying to and what we are achieving through the program and drew out different problem statements and brought some really interesting ideas together from it.
Which team rose to the challenge and took away the title and $1,000?
I think the one word that we would probably all use to describe this is surreal. When she announced that we were the winning team, we had these stupid smiles on our face and gasps of surprise because we didn't expect it. We just put our best into it, and I think for all of us, we didn't come into this really expecting to win something. We just kind of did it for various reasons and really wanted to learn from the experience. So hearing that we won is honestly just completely surreal, and we're very, very grateful and thankful to everybody who kind of made this possible in the process.
I think what impressed us was really, and for, I have to say for our patient advisor in our group as well, but for all of us, was really what is the initiative that has the most potential to impact directly on patients in the program, and something that is practically implementable. And I think that looking at the winning team finding a way to engage with the community programs that are out there. It's such a challenge for all of our patients, not just in the ICC program, but overall. And I think really looking at how to improve that patient experience, which is such a key factor for us in the ICC program, and relating that to some of the improvement opportunities. I think that was really the winning point for us.
I think sometimes coming to an innovation session and coming up with a solution that's quite simple and straightforward and drawing out something that's a big challenge but maybe not the obvious one was quite compelling, and so I think we felt this was something that could actually make a difference and something that we could achieve and work with them to do.
The winning team was really very ambitious in having a very thorough understanding of what the problem is before they really designed what the solution was going to be. So they took great initiative in contacting people in the community. They took great initiative in making sure that they asked a lot of questions of the stakeholders. They were really honed in on wanting to benefit the experience for people who were kind of on the front lines of the ICC program and the patients as well, right from the very beginning. And it was very clear that they wanted as much information as they could get in order to make their solution fleshed out, and ultimately something that was very easily integrated into what currently takes place.
All the teams were able to come together with impressive creativity and leave with skills they can apply to their future careers.
Some of the skills that we learned during this innovation sprint would be communication. That came across with the pitches, especially being able to synthesize our entire solution, which had several facets to it, into a succinct 12-minute speech was something challenging and really honed our communication skills.
Working with such an interdisciplinary team, working with people with different backgrounds, different knowledge bases, it's something that you'll have to deal with in your everyday to-day life.
A lot of skills that I personally learned, and I think our team has learned, is mostly soft skills. So that includes communication, that includes ideation, and a lot of skills that we learn from each other, such as process maps specifically, and as well as coming up presentations and verbal, written communications. And I think those are very helpful for any endeavors or any work in the future.
The skills I think that personally I learned most were related to presenting new information and developing our idea. And then as a team, I think we really learned about how to work together and overcome barriers as a team and develop something that we have some passion in.
Well, luckily for me, this is a career and kind of career path that I was really interested in going into. So the skills that I learned here in terms of like thinking and design thinking and like modeling and all of those different types of things would be really useful for me, like going forward and kind of keeping it in my mind in terms of how I can apply it to my career and kind of seeing that there's more than one side to things. Like you have to take a really interdisciplinary approach to anything. It's not just like a single field problem. So I think that's really where it's going to become applicable.
Thank you very much to everybody who organized the Innovation Sprint. Sarah, Laiba, and Megan for making everything happen. It's been great.
Did you miss the previous videos about this innovation sprint? Follow along on Facebook, Instagram, and Twitter with the hashtag InnovationSprint. Learn more at stjoes.ca.